Alright folks, I'm uploading this video because I'm planning this case right now for replacement of two congenitally missing lateral incisors. The site that you see here and the both sides have been grafted before in order to place those implants, and you can see the amount of robust bone that we have achieved. This is the left lateral incisor, plenty of good bone there. What you see there is a Meisinger master pin from our ridge augmentation. Very good spacing between the teeth, and the same on the other side where we have a little bit less space. A 3-0 implant has been chosen, and you can also see how much bone we have, a good amount of bone. Again, a Meisinger master pin on the palatal that needs to be removed the day of the procedure, but this is very beautiful. This is beautiful. This is an excellent grafting outcome. The reason why I'm uploading this case, though, I wanted to show you this. Pay closer attention to the model right here. The yellow is part of an optical scan that was acquired with a 3-safe, and the gray is the CBCT. So look at the zenith of the canine, the zenith of the central incisor, again the zenith of this central incisor, and the zenith of this canine. It's very obvious what's going on here, especially by looking at the bone on the CBCT. This is a classic case of altered active eruption, where osseous recontouring needs to take place and then apically position flap. Now, we don't have the clinical image, but you can imagine the amount of keratinized tissue is rather minimal. That needs to be apically positioned instead of gingivectomy. There's just not enough amount of keratinized tissue in this particular case. So that crown lengthening, if you will, that aesthetic crown lengthening, if you will, in order to have the most optimum outcome for our implants, needs to take place either before, which is preferable, it's much more predictable, or at the same time with implant placement. If we don't do that, what we're really doing is that we're basically locking this individual, this patient, in a situation where the gingival zeniths are not ideal between all these 6 front teeth. And it may look okay now when this particular individual is in their early 20s, but think in 10, 15, 20 years down the road, these are the cases where these teeth continue to erupt, bringing the gingiva down, and our implants are still up there, and now we're dealing with an anesthetic outcome. Always something to keep in mind when these cases are planned, digitally or not. Well, thank you, and I'll touch base with you soon.